Now, who were Healthy Child's research partners? The consortium was made up of 15 organizations from across Europe, which all had specific skills necessary for the completion of the project, and which were globally coordinated by Siemens Aktiengesellschaft, the famous German company, and managed by Lynceus in Rome. Let's listen to David Mancé, the MART-G Knowledge leading technological person, briefly summarizing the consortium structure.
So here's the Healthy Child Network after 4 years. It is now made of 5 pediatric hospitals. Johns Hopkins joined us later on. There is the OPBG in Rome, Necker Enfants Malades in Paris, the Great Ormond Street Hospital in London, and the Istituto Giannina Gaslini in Genoa. So that makes it 5 pediatric centers that are connected to the network, together with 7 technical partners developing the actual applications and maintaining the platform.
As already said, Healthy Child started in significant funding from the European Commission, which represented more than 70% of a global budget of 17 million, provided altogether also by the other involved partners. Healthy Child started with the goal of developing an advanced IT platform for improving clinical outcomes, diagnosis and treatment selections in pediatrics. An advanced IT platform which clinicians and researchers are using to securely share integrated and anonymized clinical data across 4 European pediatric centers was put into being, as we have seen, and tools to automatically curate the database, browse patient data by utilizing graphical knowledge representation, perform similarity searches, and implement knowledge discovery investigations were also developed. Some other highlights of the clinical developments have included a new magnetic resonance image-based scoring system for juvenile idiopathic arthritis, allowing to better track the evolution of this disease, and personalized heart models for advanced diagnosis and intervention planning in cardiology were also developed as a step towards a fully personalized pediatric heart model. The disease modeling work that Healthy Child has done, and which we will look at, was started before the European Commission had put the virtual physiological human research at the center of the Framework Program 7. Healthy Child's work in some respect preempted this exciting new field of research on a European level. To briefly explain the virtual physiological human concept, it is sufficient to say for now that it is a technological framework that aims to create an integrated computer model of the mechanical, physical and biochemical functions of a living human body. Let's hear from Martin Huber, the technological coordinator of Healthy Child and coming from Siemens, who will now explain to us how data integration was the guiding principle behind the Healthy Child project.
So let's just have a look at this graphic. We have a lot of sensor data, which comes from the medical imaging, nowadays also from genetics. We have a lot of clinical knowledge, and all this data gets processed, and we enter it in one large distributed database, which is distributed across the hospitals participating. And based on such an integrated view of the data, we provide applications mainly for the clinical researcher. So our main focus is clinical studies to support the clinical researcher, but also, and I'm going to show such an example, we want to help at the point of care for clinical decision making.
The Healthy Child project is focused around 3 disease areas: rheumatology, cardiology and uro-oncology, which we'll look at shortly. But it is primarily an ICT project. To understand how we built an ICT project in the clinical realm, we can listen to Jörg Freund, our project coordinator from Siemens.
What we have is 4 hospitals connected. This is the Gaslini Hospital, Great Ormond Street Hospital, Necker Hospital, OPBG in Rome, Paris, London and Genoa. And we built a grid infrastructure, or we use the grid infrastructure around it, which is EGE Lite, and we built our gateway that deals basically with the data management and the query processing, ontology layers, and some security issues and access rights. On top of that layer, we focused on 3 main areas that where we techies are working on. So we work in the area of knowledge discovery to try to figure out what is in the data. We also use the data to build models on the diseases, on the heart diseases, on brain tumors, and also in the rheumatology. And this is then the areas where we focused in pediatrics, cardiology, right ventricular overload, cardiomyopathies. We focused on gliomas in children.
How has Healthy Child utilized the information and communication technologies? We have seen already that Healthy Child works by integrating heterogeneous medical data, ranging from clinical data to imaging to genetics, and combines it all into one single repository. On top of the repository, advanced applications have been developed for clinical decision support and knowledge discovery.